asked to talk to you a little bit about back pain and how we respond to back pain. So Lynn has actually talked about some of the figures and the data on the burden of back pain, of musculoskeletal disease in general, but I wanted to talk, just show some figures that are specific to back pain. So right now, right at this moment, 1/5 of the global population has back pain. That's around 650 million people with back pain. Because back pain is so prevalent, and it's not only pain, so it does affect your capacity to perform daily activities. It is also one of the main reasons forcing Australians to leave the workforce. So because of that impact and the number of people affected with back pain, it is estimated that around the world, 72 million years lived with disability are actually because of back pain. Right now as well, 1 in 4 Australians are seeking care for back pain. And most people will actually get better in 6 to 10 weeks. So about 60% of people with back pain will get better in 6 to 10 weeks. But the problem is 1/3 of those will have another episode in the following 12 months. And the second episode tends to be worse or more severe than the first one. It doesn't seem to be this. So anyway, I'll keep going. So one of the questions that we ask is, who develops back pain? So why do people develop back pain? So we decided a couple of years ago to have a look at the literature, to have a look at all the papers, all the science published, and identify the activities, characteristics, and factors that actually make people more susceptible of developing back pain. So what we found was that age was highly associated with the risk of developing back pain. So, you know, if you turn 45 and you notice that all of a sudden your back started hurting a little bit, you know, this is actually a fact. So if you're older than 44, you're 3 times more likely of developing back pain. Prolonged standing and prolonged sitting. So those activities are occupations that will actually require you to sit or stand for a long time, will also increase your chance of developing back pain. Same thing for driving for longer hours. So if you've noticed that, you're correct. Whole body vibration. So those occupations or activities that will actually be associated with whole body vibration, they will increase your risk of having back pain. And poor sleep quality will also increase your risk of back pain. So if you have a bad night of sleep and then you wake up feeling back pain, that's not in your head. You know, you are more likely of developing back pain if you don't sleep well. The problem is, unfortunately, even though we have identified a number of risk factors for back pain, we still haven't been able to identify effective ways of preventing back pain or effective ways of addressing those risk factors, which is probably one of the reasons why the burden of back pain has actually been increasing over the years. So, at the moment, how are we responding to back pain? Because it's a painful condition, it's quite obvious that the most common or the most popular treatment for back pain is actually painkillers, so drugs. So we decided again to look at the literature, look at science, and identify whether drugs work for back pain or not. So we ran a number of studies looking at every study ever published in this field, and we looked at simple painkillers such as Panadol, paracetamol, also anti-inflammatories, and opioids. And what we found was a very consistent story that drugs won't help you much. So the benefits of drugs, in general painkillers for back pain, they're very limited, if at all. And when they do help people with back pain, they help them in the very short term, but they don't really help them in the long term. Some of those drugs, for example, opioids, they are associated with more pain relief, but they're also associated with worse adverse events. Okay, so drugs, not very good news. What about surgery? So surgery is also another very popular and has become increasingly popular treatment option for back pain. So we decided a couple of years ago to have a look at all hospitalizations for back pain in New South Wales over a period of 10 years. And what we found was actually an increase of 16% in the rate of decompression, which is the most commonly used or performed surgery for back pain, and a 300% increase in complex fusions. So that's a much more complicated surgical approach for back pain. So there has been a drastic increase in the rates of surgery for back pain. That was data from Australia, but the same thing was actually observed in the US. So we seem to be following their steps, which I don't know if it's good or bad. In the US, surgery accounts for over $2 billion every year. Spinal surgery accounts for over $2 billion every year. Bless you. Okay, so again, because we're very curious, we wanted to know if surgery worked. So it's very popular. Does it work? So we chose the most commonly used surgical procedure for back pain, which is called laminectomy or surgical decompression. So basically what happens up the top is a part of the bone, the posterior part of the bone. So this is a photo of your spine. So part of the bone is actually removed surgically to increase that middle space, or canal, as we call it, okay? Because what happens when we get older, the wear and tear of those structures around the spine will actually decrease that space, and that will put pressure on nerves. And that's why people sometimes have pain, especially pain down the legs. So this condition called spinostenosis affects 1 in 8 older Australians. So we decided to have a look at whether that worked. When we looked at the literature, though, what we found was that there is actually no association between that space and the prevalence or the severity of pain. In other words, some people have a very narrow space and no pain. And some people will have pain, will have surgery, but still no change in their symptoms. So there doesn't seem to be a very good correlation between that space and symptoms. And in fact, work that was done by Carolina, who's here, showed that over time, so this is the trajectory of pain and disability post-surgery in spinostenosis. So what we could see is that there is a drastic improvement in pain and disability after surgery, but there is no cure. So no one actually recovers. So how do we respond to that? One question that we had was, maybe we don't need to decompress the spine. Maybe we don't need to remove that bone. Maybe there is no, the rationale needs to be evaluated. How do we evaluate that? We do a placebo trial of surgery. So this is one of the studies that we're doing at the moment. So success is a randomized placebo trial of surgery for spinostenosis. Why are we doing this? Again, because we don't necessarily know if patients need to have surgery or surgically removed that bone in the spine to improve their symptoms. So we are comparing surgery to placebo surgery. At the moment, we have sites across Australia, Sydney and Melbourne mainly. The primary sponsor of that study is Sydney University, so that was funded by the government, the National Health and Medical Research Council, and it's led by researchers in this group. What we want to do, we want to randomize 160 patients. Patients are identified by the surgeon, are invited to participate by the surgeon. Then during surgery, when they are in theater, they're going to be randomized to either having the full surgery or half of the surgery, which is actually no removal of the bone. That's what we call the placebo. These patients are then followed for up to 2 years, and we're going to compare the results of the two groups. Before you ask me, it has been approved by ethics. The potential impact of this trial on policy and practice is actually obviously very big, and it's a characteristic of placebo trials. So if we do show that surgery is better than placebo, that's a very good reason for continuing to fund and endorse this type of treatment. If it's not better than placebo, that's also a very good reason to discuss the removal or stop recommending this type of surgery for this type of population. Okay, so just to wrap up, we talked about drugs not helping much. We still don't know about surgery. There is a lot to learn with surgery, whether surgery actually works for back pain, but it's not all bad news. We do know that there are some very simple measures that we can use to respond to back pain. So for example, we know that physical activity is a very simple and effective way of treating and, in some cases, preventing chronic back pain. We also know that educating people to manage their own pain is a very effective way of responding to back pain. So what we are doing at the moment is using text message or text messages to actually show patients, educate patients about what they can do for themselves to manage their own pain. So I'm just going to run a very quick video on that trial, and hopefully the video will talk for itself.
Did you know that lower back pain is the greatest cause of disability worldwide? It affects 540 million people at any one time in the whole world, and its prevalence has increased 25% in the last 10 years. Moreover, it accounts for approximately $4.8 billion in Australia alone every year in direct healthcare costs. Given that it's an important problem, how can we manage it? Medication and bed rest are not recommended by research. Surgery is recommended only to very specific cases. But what the research is currently highlighting is that self-management can improve symptoms and may be better than usual care. So, does that mean you can take care of yourself? Yes, and health professionals can help you do that. However, research has not yet shown which is the best way. And what we want to find out is if an intervention as simple as text message, yep, really simple, can empower people to do just that. But why text message? Well, research has shown that it has helped lots of people manage their chronic diseases better, such as cardiovascular disease and diabetes, as well as improving their health. It's helped people to stop smoking, to lose weight, and to exercise more. With your help, our research team will investigate if this easy, accessible, and affordable intervention can help people with back pain.
So Text4MyBack is a randomized clinical trial, and I would first like to again thank Carol and her amazing partner for coming up with this beautiful video. But Text4MyBack is a randomized clinical trial. We are going to randomize patients into two groups. So one group, they'll receive just a booklet with some information. In the other group, they'll receive up to 4 text messages a week for a period of 3 months. And these are just some of the messages that we'll send them. So the messages are around exercise, education, mood, and use of care. Again, we're going to follow them up for 1 year and see which group improves better. So we are in the process of collecting data for that study as well. And again, thank you very much. Thank you for the opportunity of talking about our work today, Deb and everyone. And again, I would like to just thank especially Carolina and David Anderson, who are amazing in helping me with those two projects. Thank you very much.